So today I'll be sharing with you the secret formula that I use with patients to make sure they're getting high quality, consistent sleep. Hi, if you're new here, my name is Parky. I'm a postdoctoral fellow in clinical psychology at Stanford's Sleep Health and Insomnia program, and I also happen to have authored my own book on treatments of insomnia. It's called The Insomnia Paradox, so ostensibly I know at least a couple things about sleep to be able to teach you today. So I'm not going to tease you about the secret formula. I'm just going to tell you straight up that when we're thinking about how do we get high quality, consolidated sleep, there's really three factors that you need to go to bed with in order to do so. So the first is high sleep drive, the second is strong circadian rhythm, and number three is low arousal. So when we have all three, sleep easily comes, and we'll talk about now how do we get each of these factors in order. So the first factor is sleep drive, and I think of our sleep drive or homeostatic sleep pressure as our appetite for sleep. And just like appetite, the longer we don't eat, the hungrier we get. The longer that we are awake throughout the day, the hungrier we are for sleep by the end of the night. And this is related to a byproduct buildup in our brain called adenosine, so that the more we are awake throughout the day and active, we build up more of this adenosine by the end of the night, so then we can expend all that for a really nice, consolidated, high quality sleep. Now, when it comes to people with insomnia or just in general, there are certain behaviors that can impact how much sleep pressure or sleep drive that we build up throughout the day. So for example, people who take naps, we think of naps as like a little sleep snack in lieu of the large dinner at the end of the night, so that can impact our ability to build up sleep pressure, as well as spending an excessive amount of time in bed. So for example, if we are sleeping 7 hours, but we're spending 9 or 10 or 11 hours in bed, that's going to limit how much time we have awake and active to build up our sleep drive for the end of the night. So one of the things that we really recommend is to limit how much time you're spending in bed a little bit closer to how much sleep you're actually producing, how much sleep your body is producing, so that we really have sufficient time to build up our sleep drive or sleep pressure by the end of the night. So people with insomnia or with sleep difficulties are very reasonably going to say, well, it takes me like an hour to fall asleep and I'm up in the middle of the night for such a long time. I need to cast a wide net by going to bed early or sleeping in order to get enough sleep. And this makes a lot of sense in the short term, but can actually maintain our problem in the long term, because the next day we're going to have less amount of time to build up our sleep drive, and then it becomes sort of this perpetuating cycle because we're never able to build up enough sufficient sleep pressure or sleep drive or appetite to be able to have a consistent night's sleep. So one thing that can be really helpful is to make sure that you're generally waking up at the same time, regardless of how much sleep you got the last night. Even though it sounds really hard in the beginning, this is a very strategic long-term solution, because then the next night you're going to have extra sleep pressure, you're going to be extra hungry for sleep if you still go to bed at the same time, and then that's going to catapult you away from the insomnia trap and back on the track. So step one was to build up lots of sleep drive or appetite for sleep by reducing naps, as well as spending a little bit less time in bed and a little bit more time awake and active throughout our day. Step two relates to strengthening our circadian clock. And I think of our circadian rhythm or circadian clock kind of like our internal clock that tells us when we should be awake and when we should be asleep. And there's a couple important things about the circadian clock. The first is that everybody's circadian clock is a little bit different. Some of us are more like early birds, some of us are night owls, others are kind of in between. And the second part of the circadian rhythm is that it's a little bit longer than 24 hours. So it's not exactly mapped on the clock on the wall. So we need to set it every single day to make sure that our circadian rhythm is nice and strong. And that means going to bed and waking up around the same time every day. And also importantly, getting some sunlight in the morning to really strengthen and set our circadian clock. So one of the issues with having a very irregular sleep-wake schedule is that the irregularity can actually create jet lag symptoms. If sometimes you're waking up at 6 a.m., other times you're waking up at 9 a.m., it's kind of like the difference between traveling from California to Maine every single week. And this is going to create a lot of general malaise and discomfort, and you're not going to get a good signal as to when you should be awake and when you should be sleepy. So the story so far, number one, we want to build up a strong sleep drive or a high appetite for sleep. Number two, we want to set our circadian clock by going to bed and waking up around the same time every day, getting some sunlight in the morning. But sometimes we can have a very high appetite for sleep and a strong circadian rhythm, but still have difficulty falling asleep. And the reason for that is this idea of hyperarousal. So if we go to bed with a very active mind, if we're worried, if we're feeling really anxious, all of those things can make it hard for us to fall asleep. So we need to make sure that your mind is quiet and your body is calm by the end of the night in order to be able to sleep well. So when it comes to these types of hyperarousal, they can be positive or negative. For example, if you're someone who deals with insomnia and lots of sleep anxiety, then scary thoughts like, what if tomorrow is going to be horrible? What if tonight I can't sleep? Those things are going to, of course, make it very hard for us to be able to sleep, but they can also be kind of positive things too. Let's say you just had a date with your crush, and you had your first kiss. You're probably going to have a very hard time falling asleep at night because you were so excited about how that date went. So the question then becomes, how can we make sure that our arousal levels are as low as possible by the end of the night so sleep can be more readily able to take us away? So some of the strategies that can be helpful include things like relaxation strategies. So if you're somebody who finds yourself a little bit tense by the end of the night, then some deep breathing or guided meditations can be helpful. Or it can just be like a general winding down period. So the last 30 minutes or 1 hour before bed, you're protecting that time for rest. So you're doing something you truly enjoy, like listening to music, doing crossword puzzles, watching a rerun of Friends, whatever that might be. It should be something that allows you to wind down and set the stage for sleep by making sure that your mind is quiet and your body is ready for sleep. So for other people, they can find that worries are something that keeps them up at night. So for example, they're worried about tomorrow and all the things they have to do, or they're worried about the finances or family or the future, whatever it might be. They're finding that all these worries are happening at the nighttime. So one strategy called worry time can be super helpful for dealing with this issue of like, let's move the worries from the nighttime and bring them a little bit earlier in the evening. So I'm doing all that processing, I'm problem solving during that time, and then I don't have to do that during the nighttime. So you might even take out a piece of paper or Word document and say, for the next 10 minutes, I'm just gonna spend that time worrying. I'm just gonna worry about anything that I want to and put my thoughts and feelings onto the page so that when I'm done, by the time I go to nighttime and I'm ready for bed, my worries are no longer there and I don't have to worry about the things anymore because I already did that a few hours ago. So inevitably there are going to be some questions surrounding proper sleep hygiene. What are the optimal conditions and behaviors that are helpful for sleep? And for the most part, I'm actually going to encourage you to follow your own felt sense in terms of your nighttime routine, the temperature, the bedding that feels most cozy and comfortable for you. There are some general recommendations that can be helpful, like avoiding alcohol, avoiding caffeine, and vigorous exercise in the few hours before bed. And then for light exposure, this is quite interesting because people often quite worry about light exposure, especially at night. But for the most part, the research seems to suggest that it's really about the relative light exposure. So if you're getting a good amount of sunlight during the day, the relative exposure of light you're getting from your phone or the TV, it's pretty minimal. So it's not going to impact your circadian system very much. I would be mindful about the content. So I wouldn't want you to watch a horror movie or look at something really scary or activating because that can impact your sleep. But for the most part, watching a rerun of Friends or something you enjoy, totally okay. And for people who struggle with insomnia and lots of sleep anxiety, it's going to be really difficult to go to bed with a quiet mind because they're really nervous about the sleep piece. And I have other videos that talk about how do we break the association between bed and wake so that we can actually make sure that the bed feels like a place for sleep and start changing our relationship with the bed. And I'll also do a more full video down the road about how we can tackle sleep anxiety. But one thing I really encourage you to think about is that the idea that when we try to force sleep to happen, sleep tends to get further away. But if we can kind of let go and trust in the right conditions of having high sleep drive, a strong circadian rhythm, and generally going to bed with a quiet mind, that is going to set the stage for sleep to be more readily able to take us away. And we have to be able to trust in that process and lean into it to escape the insomnia trap. Anyway, that's all for this video. I hope the information was helpful for you to get a couple more restful nights. Thanks for watching as always. Subscribe if you haven't, and I'll see you in the next one. Bye-bye.